Here. Okay, looks like you're off the hook, Corey. Thank you.
Thank you.
Now you should see a tab to open a file. Does that one work? Yay! We're getting there. All right. So our next item is the report of finance, personnel, and economic development on mileage and per diem for June of 2026.
$1,046. Okay. Any questions or comments? Success. 24 in favor, none opposed. Motion has been approved.
Our next items now are our resolutions for the evening. Our first resolution is submitted by Finance, Personnel, and Economic Development Committee jointly with Public Safety Committee. Resolution approving closure of the Fond du Lac County Inpatient Behavior Healthcare Acute Unit effective January 1, 2027.
Okay, is there a motion to approve? Motion by Supervisor Conley. Second. Do I have a second? Second by Supervisor Gary Will. Okay. Are there any questions or comments on the resolution? Supervisor Hayes.
Good evening. First, I want to thank our Director of Human Services, Jerry, for all the hard work she does for our county. I recognize the massive responsibilities she has, 250 employees in her department. And like our law enforcement, they deal with people mostly not having their best days. I also want to thank the many people who have reached out, and a very special thanks to the people who came and spoke at the public meeting, and those who shared deeply personal stories. I've been able to understand better the perspective of people dealing with a mental health issue, and also the family members who are just as much affected. I especially want to thank Fond du Lac Police Chief Aaron Goldstein. He was the first person I contacted when I heard of this closure proposal, and he and his staff have guided me on my journey to understand the depth of interconnectedness of mental health care with law enforcement and others in the community.
Mary, can I pause you just for a moment? We've got a gentleman sitting in the front row with a sign. I'll allow the sign, but you have to sit in the back row and hold it so the people behind you can see. I don't want you disrupting the meeting, so if you kindly move it to the back of the room, or I'm going to have to ask you to leave. So I'll ask you again one more time. Okay, sorry to interrupt, Mary, but I had to do that. Thank you.
So I will go back to where I was talking about the depth of interconnectedness of mental health care with law enforcement and others in the community, such as the St. Catherine Drexel Shelter, Solutions Center, the Warming Shelter, NAMI, ADVOCAP, our schools, St. Agnes Hospital, businesses, civic organizations, and our faith community. I don't think there is an entity in our county that is not affected by the state of mental health in Fond du Lac County. After the closure was announced, there was a meeting with our county executive and our director of human services with the Fond du Lac County Law Enforcement Executive Association. This group is all the police chiefs in the county and our sheriff. They got lots of information at that meeting, and after that, they composed and wrote a letter to county board supervisors. They began by acknowledging the diligent work of the human services staff and the recognition of budget and staffing challenges. Here's a tiny bit of what they said in that letter, quote, "This is not simply a law enforcement issue. It is a healthcare system, public safety, and community well-being issue." They went on to say public safety and community health are shared responsibilities. Services like the Acute are not isolated expenditures. They are investments in stability, prevention, and long-term cost avoidance. They said, "Our intent is not opposition, but partnership. We remain committed to working collaboratively with county leadership and community partners to identify sustainable solutions that support both fiscal responsibility and the needs of those we serve." So where did we go after this letter? I believe we are a part of county leadership. We had Jerry present to this board in April, and our board chair said that he wanted our committees to handle the issue instead of having an ad hoc committee. He mentioned adding public safety and finance to the two committees of jurisdiction. Did we get any collaboration? I think the answer is a big no. I could not get the issue on the Public Safety Committee agenda for discussion with the Fond du Lac Police Department, in spite of the fact that this resolution was going to come to that committee. Our Fond du Lac Police Chief personally attended all of the meetings where the resolution was on the agenda, and he spoke during the public comments part of the meetings, which means we gave him 3 minutes. What did he get? No discussion, that's for sure. Is that how we collaborate? At this moment, I want to recognize the Human Services Board and the Health and Human Development Committees and their chair, Supervisor Fenrick. After I was turned down by the Public Safety Committee, Chair Fenrick did put discussion with the Fond du Lac Police Department on the Human Services Board agenda. I do not doubt that the discussion they had led all 5 of the citizen members of the Human Services Board to say they were not in favor of closure with the information so far and without law enforcement collaboration. And the Health and Human Development Committee did not even bring the closure resolution to the floor for consideration. They are the committees of jurisdiction. They have had the most information and the most discussion. After finance last week, I emailed all of the police chiefs who signed that letter. And I wrote this to them. Over the past 2 weeks, Chief Goldstein has stood in front of 2 county board committees during the public comment time, 3 minutes, and asked that the closure be paused and that law enforcement leaders of our county be involved in planning what the future looks like. He has said the ask is not to necessarily to stop a possible closure. Everyone agrees changes need to be made, but to create a comprehensive, operational, sound plan involving all the community stakeholders for the full continuum of mental health services in place for Fond du Lac County. I would like to know your opinion on the closure. Do you agree with Chief Goldstein? I got 2 written responses, and I spoke on the phone with Chief Burgos of North Fond du Lac. They all echoed what Chief Goldstein had said publicly. Chief Bill Wallner of Ripon said, quote, "I agree with Chief Goldstein's assessment and those of my fellow law enforcement leaders in the county that one of the major concerns is a lack of a comprehensive plan moving forward should the closure be completed. We have heard of various suggestions or possibilities as to how things may be handled going forward should closure occur, but the lack of a solid plan and stakeholder input is a serious concern. A comprehensive overall plan on closure, how that will be handled, and the plan moving forward should be, in my opinion, an inclusive conversation plan, not piecemealed into stages." This is from Chief Jeremy Roche of Waupun. I have a similar opinion to Chief Goldstein, as I believe a sound comprehensive plan will help law enforcement adjust to any possible changes in the future. I understand that there is talk of hiring additional mobile crisis workers and possibly a transport company to help with emergency detentions. But in my opinion, this should all be set to go prior to shutting the facility down. I don't think everybody understands all of the little details. I've heard many members of this board say we have to listen to our expert, Jerry, and I understand that sentiment. We have highly knowledgeable and competent people working for our county. I also see our law enforcement community as experts and highly competent. The Fond du Lac Police Department has been accredited since 2019. Only 10% of departments in the state reach that standard. We are shoving our social ills onto our law enforcement community. Everything our society creates, they have to deal with. Who is there when people have a mental health crisis? Our police and deputies. Who is there when there's a suicide? Our police and deputies. Who is there when someone is drunk and out of control, driving a car recklessly down the highway? Our police and deputies. This is what Tom Weber, the jail consultant, said to us just last month. Quote, if you over-rely on the jail for different social problems or for your response to crime, which you are doing in Fond du Lac right now, then the jail is going to be the only solution that you pursue. I think you can all agree that it's not a great setting to try to do a lot of meaningful intervention and change with those who have serious mental health issues. But in fact, a very large percentage of your inmates are afflicted with acute and subacute mental illness, and community resources are not always available for those. So the jail becomes the holding spot for those, unquote. So that really gets us to what this comes down to. Where and how do we allocate limited resources? And for us, that means money. We are hoping that closing the acute will save money. Jerry was asked by Greg Stenslin, does the closing necessarily save the county money? Her answer was no, at least not initially. The theory is, with more robust crisis and community-based services, that you will reduce hospitalizations, but that's a theory. We have to face the fact that we are allocating less to human services. The closing recommendation comes because of budget limitations put on the Human Services Department, and they are not unique. All our departments have to work within an allocated budget. I marvel at how Tom Janke manages when he gets the same levy amount every single year, no increase. We have heard that $8 million had to be cut for the 2026 budget, and we are holding many decisions in limbo because of the jail project. The fiscal constraints lead to all kinds of other issues. No doubt, the inability to fill critical positions. Yet we chose to raise the pay of our deputies, so we pay above neighboring counties. The constraints are not the same across departments. If we look at the trend for our spending on human services, it is going down. If we look at the trend for public safety, it's going up. We are relying on theory to make this move with the acute unit. I think Tom Weber was telling us about another theory, that is providing comprehensive, accessible, on-demand, proactive mental health services will lower the number of people we put in jail and the high costs associated with that. Again, long-term cost avoidance. We have a choice. It's a policy decision. It is one that we alone make as elected county leaders. We need to pause this closure and establish a comprehensive plan. That plan needs to be collaborative, open to the public, and operationally sound. We need a careful and deliberate transition built on partnership. We need to back the blue. At this time, I want to make a motion to refer this resolution back to the Health and Human Development Committee to have them address the need for a written proposal that involves stakeholder collaboration.
Okay, that is in order. However, your wording is incorrect. You can't refer it back to a committee that did not refer it to the county board. So we're going to have to remove the word, at least remove the word back. Is that correct, Corporation Counsel?
Okay.
Well, give us a few minutes here.
Is there questions on it?
Okay, while we're typing that in, is there a second to that motion to amend? Supervisor Brault seconds the motion to refer it to the committee. Yep, okay, so now we're going to clear the queue and we're going to have discussion only on the amendment to refer back or refer to committee. Any comments? Supervisor Gary Will?
Thank you, Mr. Chair. And I know we can't direct anything to supervisors, so I'm just going to let you know that, good thing I made a second on the last motion so Ms. Hayes could read that letter. However, I do take offense to her throwing the Public Safety Committee under the bus with this. as it only came to our committee because of the transportation issue with this. And if my memory serves me right, she was on the Human Services Committee that she's referring this back to now for the last how many years before the last election. So they could have had many, many meetings over the last 2 years about this and not at the last minute bringing this up and trying to throw our committee under the bus. So I will not be referring this back to that committee. Thank you.
Okay. Supervisor Brault?
Thanks. Well, I'll correct that because I just spent the last term serving on the EAR committee with Supervisor Hayes. And prior to that, I had 2 years that I was on what was at the time the Human Services Committee for 2 years, and Supervisor Hayes was not on that committee at that time either. So anyway, so I don't know when this was, but so I had emailed Corporation Counsel to ask if there was a possibility to provide an alternative at this meeting for this resolution, because I feel that we should not be moving forward with the closure without a plan in place. And I know that Chair Abel had said that you were not interested in an ad hoc committee, but I feel like there's got to be a better way because we've been hearing so much about the need for collaboration. And so I had gotten a response back that said that, we don't really have a good mechanism to have a discussion at county board about creation of a committee. And there wasn't a real way that I could make a motion to do that. But she did tell me that the Human Services Board actually within state statute has duties that are allocated to them. And one of them, it says, powers and duties of County Human Services Board in certain counties with a county executive or county administrator. A County Human Services Board appointed under sub 4B2 shall A, appoint committees consisting of residents of the county to advise the County Human Services Board as it deems necessary. So our Human Services Board, I feel, was never given the I feel our Human Services Board. You good? Are you okay? Are you okay? You want? I got Pepsi.
I got some M&Ms here.
Okay. We're temporarily excuse Supervisor Sippel.
Okay. Anyway, our Human Services Board, I feel, is never given the opportunity or really the agency to know that they had this ability to create a committee that could help them formulate a better plan and a better way forward. And so I admit I did speak to them during public comment and said that, this is something I'd like to see them do. But they had so many unanswered questions about the resolution itself, about the potential closure, that never actually got to the point that happened. And so I'm really hoping that if we would refer this to the Health and Human Development Committee, that they could work with the Human Services Board, as all of those committee members are on the Human Services Board with the citizen members, to create a committee that could actually come with this more collaborative process that our county residents are asking us for, other mental health professionals are asking us for, our law enforcement in particular is really asking us for, and this would give us what we need to create a better path forward for mental health care in Fond du Lac County. So I am in favor of sending this to Health and Human Development, hopefully for the purpose of having a more collaborative process. Thank you.
Okay. Thank you. Supervisor Dornbrook?
I just want to, number one, just make a little correction. Chief Goldstein did come to Finance Committee, and his first, when he first talked, he talked for 3.5 minutes. And then later on, I did allow someone to give him their time so he could finish, which took another 1:45. I did that out of respect for his position as the police chief. My concern about sending this back to Human Services Committee is they had it in front of them after the Human Service Board met, and they elected to take no action. There was no vote to deny the resolution. to vote down the resolution to close the center. They just, I don't know exactly why. They had 5 members of the Citizens Committee that was in favor of not closing it, but they elected not to. And if we were to send it back, I would sure like to see a timeline. I would like to see 3 months where we have an answer in 3 months, so we don't push this down the road further and further and further. And so that would be my thought. I don't know what Supervisor Hayes or the other supervisors that are willing or wanting to send it back to, or send it to a committee, if they have an answer of how long that process would take or how long they think it would take. Thank you.
Thank you. Supervisor Herlache?
Yeah, I'd just like to say I would like to, I'm going to be voting to send it back to the Health and Human Development Committee. I think it'd be a great idea to have a comprehensive plan. I have spoken to some of the police chiefs myself, and they, have not been involved in the process. I actually informed the Ripon and police chief, Waupun police chief myself of the potential closure. So I think we need to involve the stakeholders, and a comprehensive plan is needed in order to move forward when this is one of the most important issues, and it's the #1 issue facing our county right now if you talk to those police chiefs. Thanks.
Okay, thank you. Any other questions or comments on the amendment? Supervisor Griffith? Bear with us. There you go.
Thank you. First, I'd like to say I really, really appreciate the comments that Supervisor Hayes made, and I echo a lot of the same sentiments. I'm on the Human Services Committee, and I unfortunately was out of town for that meeting. I was in Vermont, and I am unhappy that the committee didn't do anything. If I'd been there, I would have insisted that we do something. I would love to see a comprehensive approach to this issue, and I think we need time. I agree it needs to be time-bound, but I don't think 3 months is adequate. I would love to see us put together a real collaborative plan with all of the input that people are eager to give. I have some comments that I prepared, and I'm wondering, Mr. Chair, if we're going to come to a vote on this, right, first?
We need to, if it is referred to committee, then debate stops.
Okay.
And we don't come back to it.
Okay, I think I'm going to share my comments because they are relevant to this.
Germane to the postponement.
They are. I think they're relevant. I think they're
Then I will allow it.
Okay, thank you. I would vote in favor of this resolution, in part because I understand the challenges the unit faces. I wrote a long article about them. I favor keeping it open, not, at least at this time, not because the acute unit is perfect. It's not. It's also not because I don't understand the burden this whole situation has been for our hardworking county employees. I get it, and I hope we can find a way forward that ultimately eases these burdens. I am in favor of bringing this decision back to the committee for a simple reason. After months of testimonials and letters from county residents about why we need the acute unit, it seems to me that the people have spoken, and they have resoundingly said no to closing it. We've heard from law enforcement professionals, from acute unit employees, from social service providers, from former patients and their families, from medical professionals, from community activists and leaders, from people in my district and probably all of our districts. There are a lot of considerations that go into how I vote on any given issue. On this one consideration trumps all the others. How does the public feel about it? In this case, out of the dozens of people who've reached out to us, only one thought we should close the unit. All the rest, including many with lived personal and professional experience of the matter at hand, feel strongly that the unit needs to stay open. In addition to the fact that I was elected to serve the public and the public's preference is clear, there's another consideration for me. There's a lot of anger and distrust in the community right now. There's a perception that we're not listening. There's a perception that we make important decisions without public input, and that when we do invite it, we don't take it seriously, that it doesn't matter, it doesn't change the outcome. There's a perception that we would rather lock people up than treat them, and that we'd rather build a jail than save a hospital. I think this is a situation where the most important thing we can do is demonstrate to the community that, yes, we are listening, yes, their input matters, and yes, we take their concerns with utmost seriousness. We're heading into a couple of years of difficult decisions about the new jail. And if we want the public to support the plan we come up with, we need to show we're on the same side. I will admit that I'm not sure that there's a solution that will allow us to save the acute unit for the long term, but I am sure that we owe it to the community to explore every path before giving up. I would like us to invite the numerous stakeholders in this to into some kind of a process in which we have a real dialogue about the needs, constraints, and pressures we all face in trying to care for some of our most vulnerable residents. We need to invite these stakeholders to problem solve with us. Even if our efforts don't ultimately allow us to save the acute unit, they will help us build stronger partnerships to best meet the needs of our community together, with or without the acute unit. Thank you.
Thank you. Supervisor Dornbrook for a second time on the amendment.
I would just like to maybe ask Supervisor Hayes, who made a motion with this amendment or introduced this amendment, what she feels is a timeline to getting an answer and moving forward. I would like to say maybe 3 months isn't enough, but maybe if this does go back to committee, we could give them direction to report to the board in 3 months their progress, and the next 3 months come with a decision to move forward one way or another. So to Supervisor Hayes, what are your thoughts on a timeline?
Excuse me, I'm checking with Corporation Counsel here, so bear with us. There you go.
Comments on the board floor should be directed to the chair. So I don't know if the chair wishes to flesh out, if this motion were to pass, a time frame to bring this back to the board floor as a definite time. Because you have 2 other committees that have also approved this resolution.
Yeah, and correct me if I'm wrong, I have the ability to bring back the resolution anytime because it has been passed by 2 other committees. So if it doesn't say it in her amendment, I don't know how we would enforce that anyways, I guess is my point. Is that correct?
As it stands right now, yes.
Okay.
So my question to the chair is, would you be willing to ask Supervisor Hayes what her estimation on time is? Because I can't answer the question.
Supervisor Hayes, do you want to amend? Let's say not amend it. Do you have a timeline in mind?
I am totally in agreement with Supervisor Dornbrook. I think the idea of 3 months and then a report back is reasonable. But I also would like to refer to Supervisor Griffith, because this is her committee, and she's been intimately involved in this process.
Supervisor Griffith isn't the chair, so it's not her decision.
Oh, yeah, and the chair isn't here.
Correct.
Supervisor Myrachuck is the vice chair. He doesn't have the authority. Okay.
I think we're crossing some kind of weird line here, so.
That's what we're here for.
I'm going to leave that unanswered for right now, because unless it's going to be part of the amendment, then I don't think we're going to try and address it. Okay, Supervisor Ryan?
I feel strongly that this is very, very broad. It's very broad. There's not bullet points that we're looking at, and specifically, we're giving a committee a charge of doing what? Sending it back to do what? I have a resolution which, if this fails, I may introduce. That's very specific about particular areas that we want answers to. I hate to send something back to committee and say, show up in 3 months. I don't know how you're going to be able to put that together. I really don't know how you're going to be able to put that together. So I understand the intent, and I'm not going to support the amendment, but I think it's too vague and too broad unless we want to narrow it down.
Okay, thank you. County Exec Kaufman, you wish to respond to upon the amendment?
So I've heard the various comments with regard to the attempt to move this back to a committee. It just gets a little frustrating because I understand the emotion that's in all of this, but where was all of this over the last year? Why hasn't the committee taken up? I had to suggest to the committee to hold a public hearing for this. They didn't do that. I had to suggest it to them. We've been talking about this issue since Alan's time as county executive. We've been dealing with this issue for how many years? Jerry needs to be given the credit and the respect that she is, in fact, the expert. She lives this life there every single day running that department. She knows what the staff issues are. Move this 2 or 3 months down, it's not going to change the outcome. Now you're going to run into the budget time. That was the whole point of this discussion. We need to address this. So to move it now back to a committee, for what reason is that going to accomplish with this? We all know what the budgetary issue is. We all know.
Go ahead. I'll just ask the county exec to wrap up his comments and we'll move on.
So that point is, it doesn't change anything. It doesn't change anything because this should have been taken up beforehand. Jerry's made her proposals 3 different times, detailing out what she's proposing. But Supervisor Hayes might not like that, but the fact is, where were they before? This should not go back to a committee. It just vote on the resolution.
Thank you. Supervisor Herlache.
I would just like to make the point, I was on that committee, and when it got brought to us in February, we had turnover in the committee. I'm no longer on that committee. I also would have forced the committee to take a vote on this. I would just like to point out that the closure got brought in February. That's when it got brought to us. I was blindsided by it. I had heard whispers that there was issues with the acute unit, but we had never, the topic had never gotten brought up before, other than like whispers outside of meetings that there's an issue. So it's frustrating for me to hear that we should have been talking about this for years. I was on that committee. I would have, I would remember if any of that stuff had gotten brought up at any of these meetings. And for me, it's frustrating to hear that. And now with the timeline that we've been, it's February is when it got brought. There wasn't much discussion to be had on it. We were all kind of blindsided by it. We got Jerry's presentation, which I appreciate. I was looking at the numbers too. I did a deep dive on this as much as I could. I'm no longer on that committee, so I haven't had the chance to do as deep of a dive. I made a bunch of phone calls to police chiefs, got their input. I heard that it was a bad idea. So I think it's a good idea to postpone this. I understand that it's a budgetary issue for Sam and for the administration. I understand that it sucks. It's not a good situation, but we can't move forward without a comprehensive plan. I've been speaking to other supervisors. They need more information. Nobody feels good about this. I do agree that there needs to be a timeline to get this brought back to us so that we can get the information to administration as fast as possible. But without a comprehensive plan moving forward, I don't see, without buy-in from the stakeholders, how we can continue to move forward and vote on this issue when none of us have the information we need. So that's all I got to say.
Thank you. Any other questions or comments on the amendment? Supervisor Griffith for the second time.
Yeah, I guess I have a bit of an uncertainty. Having been on the committee for, 4 years now, I feel as though it's been an issue it's been gradually moving more into our consciousness over time. And I guess I have felt really sort of helpless to make anything happen. I've asked a lot of questions. I also have talked with people outside. I've read a lot of letters. I've been in touch with people who wrote them, and I've had people call me. But I don't feel as though on the committee I have the power to make anything happen. I can ask questions, but I can't make anything happen. I can't make sure that the right people are in the room. I can ask questions on behalf of people in a lot of our meetings, but they're not allowed to ask questions. And I feel frustrated with the limitations of this, and I feel like maybe this would work better if it came with the full force of the board saying, we really want to see some collaborations come out of this. We really want to see some relationships explored and some possible I want to make sure that there's some heft behind it if it comes back to our committee. I would love for it to come back to our committee. I think there's some really good work that we could do. But I want to know that as a committee and as a board, we have the authority to demand that. And I guess I'm not always sure that we do. If anybody could give some clarification, Mr. Chair, or anyone, because it just doesn't seem that it happens that way.
Well, I guess, well, all I will say is the agendas are set by the chair of your committee. You guys elect the chair of your committee. So it's up to you to work with your chair on who you want there. That's, I mean, without getting into too deep a dive, we need to talk about the amendment here, but that's kind of the process that's in place. So Supervisor Hayes for the second time.
I just want to add, for the benefit of the questions that Supervisor Griffith is asking, and something to bring back something that Supervisor Brault said, which is it was a couple of weeks ago that she found out that the committee, the Health Services Board, has the ability to appoint a citizen committee, and I should clarify that. It's a resident committee. And I don't think any of the members of that board, and 5 people on this county board sit on that board, knew that that particular power was given to them by state statute. In addition to that, in our board rules, it says that any committee can appoint a subcommittee of 2 members. So I think that, you know, part of the problem has been that many of us don't understand the powers that we have that we can maybe try to use. But as you said, you know, it's the chair of the committee that has the power to control those agendas. So just for information.
Okay, thank you. Any other questions or comments on the amendment to the resolution? Supervisor Dean-Will.
Thank you, Mr. Chair. I'm just a little confused when people are talking about a comprehensive plan. I believe we have a comprehensive plan, and that came from the director. She has explained explicitly as far as what her intentions are and where we are going forward with the mental health concerns. I agree there should be more collaboration. And I think if this passes tonight, that there will be a window there that people can collaborate. I think that the state of Wisconsin should also be included in that collaboration. But to send this back to a committee, I'm confused with that thinking that in 2 or 3 months that there's going to be, like, all of a sudden this comprehensive plan that they're going to come up with just does not make sense. There's 3 people on this board, Supervisor Dornbrook, Supervisor Conley, and myself, that were involved in law enforcement. And I can relate to when I first started to where the healthcare center is now, and it is totally upside down in that, as far as census, as far as operations, and even in some of the testimonies and conversations that I have, generally people say, yes, it is inevitable that this is going to close. So I'm not sure what 2 months, 3 months, 4 months, 6 months, what that is going to change. But if it is voted on tonight and it is approved to close it, there is definitely time from July to January 1st that people can collaborate with law enforcement. I think, like, one of the issues that's concerning law enforcement is basically the transportation part of it. And I think that can be worked out. And I just think that by
postponing it, we're not accomplishing anything. And I know that there's a lot of emotions. I actually haven't received a lot of calls, but I have talked to people. Some are for it, some are against it. There's a lot of information that hasn't been shared. There's a lot of misinformation out there too. But as far as supporting this, I will not be supporting this. Thank you.
Supervisor Brault, but I'll allow, I think you just talked once on the amendment. Okay, we're trying to keep track of this. It's turning into a little bit of a nightmare here for us. So I'll allow a second time on the amendment.
I appreciate it. I want to respond to some of the things that Supervisor Will just said, because the chief of police of the city of Fond du Lac spoke at the public safety meeting and was very, very clear that law enforcement was never brought to the table to discuss the closure. He made it very clear that so many other community partners, NAMI, AODA counselors, social workers, Solution Center, St. Catherine, Drexel, our homeless shelter that work with a lot of individuals that have mental health needs, none of those entities were brought to the table. I went to the public safety meeting that was supposed to talk about the public safety aspect of this resolution, and they did not invite a single law enforcement officer, not even our sheriff, to speak to their committee when they were discussing whether they should pass this resolution or not. That is the major example of the very lack of collaboration that has happened on this plan to close. And that is what our county residents are demanding of us, is to see something that is more comprehensive and collaborative to bring the right voices to the table, because most of us on this board are not mental health professionals. You know, we don't have the background that a lot of the people that have been reaching out to us do have. And they have been, yelling, why aren't we listening to them? Why aren't we bringing them to the table when, especially, the people that are working most closely with these individuals in our county, they haven't been engaged. They've been engaged. They've been watching us and throwing their hands up in the air and saying, like, what is wrong with us? Because we're not bringing their voices in and actually respecting their views and making this a comprehensive collaborative plan for mental health care in Fond du Lac County. And in fact, our county health department, in a 2024 health assessment, did a survey of our county residents and asked them what are their top priorities for health-related issues in Fond du Lac County, and mental health was the #1. And yet, this is the first time that the county board has been actually discussing mental health, and it's not to create a plan to make better mental health care in Fond du Lac County. We've been having a lot of budgetary and staffing issues with an acute unit, so we should close it, and we'll figure out what's happening after we've passed the resolution to close it. That's not a plan. That's not collaboration. That's not comprehensive. It's just throwing something at the wall and seeing what happens after that. I know that Jerry has said she wants to hire more crisis workers, but that's not even in the resolution. There's no mention of a plan to expand our crisis program. There's no budgetary impact in this resolution. So the best we can do is say, please send it to a committee that is a committee of jurisdiction over all these issues and give them the agency and the authority to do the work that they are actually state statutorily given to discuss this issue. I don't know what else to say, but people are screaming at us that this is not a good process and we look foolish. And it gives them absolutely no faith in us as we have to discuss an even bigger issue of a really huge project for our county jail. If we take this vote tonight to end up closing this unit, we've shown that we don't know how to collaborate. We've shown that we don't know how to actually make a better process to make good policy decisions for our county residents. And I think that would be a really terrible thing to do. So we need to send this to a committee to just get a pause on this, because we should not be voting to close the unit tonight.
Thank you. Any other questions or comments on the amendment? Okay, I don't see any, so we're going to move to the vote. Now, just to clarify, voting yes on the amendment sends this back to committee. Or I shouldn't say back to committee, it sends it to committee. So, voting nay means we continue discussion on the actual resolution. Okay, the amendment has failed. 8 in favor and 16 opposed, with Supervisor Griffith, Sippel, Rickert, Myrachuck, Rodman, Herlache, Brault, and Hayes voting in favor and everyone else voting opposed. So now we return to the original resolution that you were presented with, and we will continue discussion. Supervisor Brault.
Thank you. So I had a feeling that's how that would go, and it probably shows how this resolution is going to go. But I prepared some things to say, and so I want to say them anyway. So first of all, I want to say thank you so much to the people who came to our committee meetings, or I'm not on one of the committees, but came to the committee meetings that were held on this resolution. Because I feel like in the committees, they weren't really given a lot of thought. They weren't thanked for their testimony. But anyway, I really appreciate how brave so many of those people were. And the number of people that I've talked to personally on this issue has been almost overwhelming. Not to say that's a bad thing, but it's just mental health is a really heavy topic. I've heard from current and former county employees. I've heard from other mental health professionals, community leaders, law enforcement, family members of people who have dealt with mental illness, people who've dealt with mental illness themselves, people who have had their lives saved by the acute unit, and also people who have lost loved ones to addiction or suicide. I've had days where I have cried because of the weight of these stories, because I know what it's like. I have my own story. When we first started talking about the acute unit, I wasn't initially planning to share this because this isn't about me, but I know how hard it can be to talk about mental health, and I know the amount of bravery it takes to open up about mental illness, and I want to return those acts of bravery. I'm also very concerned that many members of this board must not know what it's like to deal with mental illness, either personally or through a loved one, because I feel like many of the members of this board are looking at this simply as a business decision and not how it impacts real people's lives. Maybe you're the lucky ones who have not had to deal with this, but I do know a lot of stories have been shared during committee meetings and through phone calls and emails. And while I hope that you've been hearing them and taking their stories to heart, I want to make sure that everyone hears at least one story before we make this decision, because since we don't have public comment, people weren't able to address the full board. So I was diagnosed with major depression when I was in high school. I went from being a straight-A student who was all involved in all kinds of things, had lots of friends, to someone who could barely get out of bed most days. And when I was 17, I was hospitalized for my depression. I was at St. Agnes. I was not at our acute unit, so I don't have experience personally with our county facility, but I know how important inpatient care is from my firsthand experience. I also know how truly debilitating mental illness can be. I know how isolating it can be and how hopeless everything can feel. Some of our residents who spoke up at committee meetings told some of you that people suffering from mental illness can feel like they don't deserve care, and they would see the closure of our unit as just another example of that. And I feel that's absolutely true from my experience. You feel like you're a burden. Mental illness doesn't always make sense, and the treatment isn't straightforward. Getting better is hard. It's possible, but it can be so hard. Mental illness also still carries so much stigma. When I was sick over 20 years ago, the stigma was arguably worse. I didn't tell many people what was going on. It's still hard to talk about. I'm pretty sure the rumor at school was that I had cancer or something, and I didn't do anything to correct that because I didn't want people to really know the truth. My own family didn't even really understand my illness, and I felt a lot of shame. The one thing that has given me so much hope is that people are so much more willing to talk about mental health openly now. So many more people recognize how real mental illness is, and they want to see more help available, not less. Our county residents are telling us loud and clear that they want us to make mental health a priority. But as I mentioned, even though our own county health department found in a 2024 community survey that our residents identified mental health as our top health priority, this is the first time the county board has really discussed it. And it hasn't been how to improve the services and deal with the problems that we're hearing about. It's to shut down a service that county leadership has found problematic and then hope we can develop a better crisis intervention system along the way. Our county residents are clearly telling us this is a terrible process. They want to see actual collaboration, they want more voices involved, and they're telling us that none of this should start with closing our inpatient care facility. Fond du Lac Police Chief Aaron Goldstein has been trying very hard to get you to see this. He showed up at all the committees that had this resolution before them, and I want to share some of the things he said at Public Safety. He said, if I want something to fail over time, it's going to fail. And he also said, if I watch where the money is going, it's not going to our case managers, it's not going to our social workers, it's not going to nurses, it's going to law enforcement. As I said, law enforcement hasn't even been at the table on this, as so many other entities have not. The process has been so insulated. Another resident at the Public Safety Committee meeting did say that creating a real plan could be a full-time project all on its own. But she pointed out that we had a committee for the golf course, for goodness sake. You say you trust Jerry's leadership, but the police chief of the city of Fond du Lac, the other law enforcement executives in our county have made it abundantly clear that they have not been part of the process. Where is the faith in their leadership? What about the opinion of all the other mental health professionals who've reached out to us? Or AdvoCap, or the Congregation of Sisters of St. Agnes, or some of us received an email today where Father Ryan Pruce from Holy Family put out a YouTube video saying that we shouldn't close this unit. What about the doctors and the nurses who've reached out, or the family members, or people who have suffered from mental illness? We're saying that we aren't listening to any of them or trusting their guidance or leadership on this. A resident emailed us today and told us leaders call together other leaders. That's what we should be doing, and we haven't done it. The resolution itself should be clear that it's pretty bad. We're told the plan is to hire more crisis workers. This has absolutely no mention in the resolution being voted on tonight. There are no budgetary commitments made in the resolution. We don't know where the crisis workers will work, if they'll have a place they can bring people that are in crisis. We know we've had difficulty hiring nurses, but no one has talked about whether crisis workers would be any easier to hire as we try to solve this problem. We should not be starting with a resolution to close our inpatient unit. That might be something we need to do down the road, but that's the worst possible place we could be starting, and everybody is telling us this. Please vote no on this resolution and show that we want to find a better path forward. Thank you.
Thank you. Supervisor Luehring.
So first of all, I have my own mental health business. I'm a counselor, and I know how important it is to have mental health care. And when I ran, this is a big part of what I ran on. A lot of our homeless community, I would say the majority, there's some mental health issues going on. It's very important to me. So when this started, I was totally against this. I have wavered back and forth on this. I've been totally against it, then I was for it, then against it. And it's based on who I talk to, right? So I feel like I'm a supervisor that does my job. I have interviewed Ryan Waldschmidt, our sheriff. I've talked to Aaron Goldstein, our police chief here in the city of Fond du Lac. I've talked to Jerry, I've talked to Sam, I've talked to some of the workers. I feel I'm very well educated on this topic. So if I go back and forth and I change my mind, it's because I'm getting new information. I do know there's a difference between inpatient, right, and acute. And I think a lot of people think we're taking away inpatient care, and a lot of people who come and talk to us are actually people that are for inpatient care and not for the acute unit. And so I think like when people give us stories, that inpatient, that's not what we're talking about. We're talking about the acute unit. And what I've come to realize is we're not taking away any care. The care is going to be there. I was concerned about the money and the doctor because, you know, it's possible if that doctor leaves that we have there, we're going to have to close the acute unit anyways. I mean, shut it down because we need a doctor there. I feel like, you know, we could be spending, I think Jerry said when I listened to her talk, anywhere from $1.2 million in 2026, and it could go all the way up to $1.8 million in 2027, and it keeps going up. And that's if we keep it open. And this is taxpayer money, and I do feel that it's really important for us as taxpayers to invest in mental health, okay? I don't want anybody to think that. I don't think that. Closing the unit would mean that initially, because there's rumors that it's going to cost more to close it, and initially we're going to put in maybe around $1.2 million in 2027, up to 2027. But then after that, it's going to level off, and we're going to kind of stay level, right? This means that, no, initially it could cost more, but it's not going to cost more going forward, where keeping it open will cost more money, and we're just not, I don't even know, it's just not sustainable. It really isn't. And as a supervisor and being involved in mental health care both, I have to sit and look at this and think about it in a logical way. And, you know, everything in me says, no, don't close it, because we need this, right? But nothing's going to go away. At least that's what I've been told, and I feel very strongly that that's true. We don't have it in the budget yet, but I'm not sure if that's planned for this budget, but I would imagine it is going to be in this upcoming budget. We are heading into budget season here, so we will know this really quickly. I do also feel that the police chief and that our sheriff are also experts, and their opinions do matter, and I have listened to them, and I really, like I said, I can totally agree with them on a lot of this, but I can also see that the plan going forward that, you know, and just down to yesterday, right? I've decided that the plan going forward does look like a really good plan. I mean, I talked about it, asked questions about it. If we could get maybe the sheriff or someone, I'm not sure, but I'm asking Sam, or Steve, is there a way we can talk about the transport? Because what we would have to do is we would have to get people stable and transport them out of the county to where they need to go. And I mean, 67 counties are not, they're not doing this anymore because it's not sustainable. And it's awesome that our county is still doing it, but I don't think they can find a way to keep doing it. And I don't think they can find staff that are going to staff this. And that's the problem, and I don't know if the public really knows all of this. And like I said, inpatient isn't going away, but we are still going to be taking care of people. They're still going to be transported somewhere where they are going to be taken care of. So we're not going to do that. So I don't know if people just aren't aware of that. And yes, it's great to keep them local because there's a lot of emotion and it's your family. But remember, 67 counties, they don't have that option. So is there somebody that can inform us about the transportation, which could help us a little bit?
Mr. Kaufman, would you bear with us while we turn your mic on here, if you could answer that question, please?
Sure. Currently under state law, law enforcement is solely responsible for all transport in the city and out of county. They don't get compensated anyway by the county for that service itself. What we had proposed going forward with regard to the new crisis worker program is that we would look at either reimbursing those municipalities if they decide to contract out the transport for out of county, or we would look at, they have officers that do it, pay them directly the overtime to reimburse them for that expense. The other option we did talk about, and I have talked to the sheriff about, this county board went through, directed I create 12 officers in 3 years. One of the options I discussed with the sheriff was the possibility of hiring another deputy sheriff, and the sheriff's department would take on the role of out-of-county transports. In the end, the municipalities would not bear the cost of that expense that they're already incurring right now itself. Nor if we take it over, they would no longer have a need to send their officers out of the county to perform that service. So that is the transport component that in the next phase, if this passes tonight, we would be talking to those law enforcement agencies directly.
Okay. Does that answer your question?
It does answer my question. I mean, it sounds like to me we won't have to pay for the transportation. And so, I mean, it just comes down to emotion, right? This vote. It comes down to emotion because there will be care. And it's not, we're not, I mean, it's nice, again, like I said, to have it in the county. That was something great that we had going on. It's not sustainable going forward. And I think that we know that. And I think the other option is just exponentially not affordable within the next 2 to 3 years already. We are, we don't even know what we're going to be paying for that. And then I also wanted to know, is it going to be in this budget? Will we know, because there's people that just don't trust things and aren't sure, is this going to be in this budget?
Mr. Kaufman, go ahead.
Yeah, if I can answer real quick. Yes, if the county board decides to pass this resolution, the next phase would be to create the program, but we would be collaborating with the outside groups, including NAMI and other groups in regard to the crisis worker program that we're looking to change. Any changes we make, including additional staffing, does have to come back to the county board and the committee, to Health and Human Services Committee, for a discussion, and then ultimate finance and part of the budget for the 27th. So the county board and committees would still be involved in the next phase as we look to make those changes.
Okay, well, and I just want to say I'm going to out loud hold people accountable, because I want to make sure that what we're doing here, right, if we do close it, that we're not going to see us increase costs beyond next year. That, we're, okay, now here we closed it, and then if we kept it open, the costs are going up, right? They're going to just keep going up. I want to make sure that it is going to eventually level off, that we are sure of this plan. And I mean, and also I feel like we need to collaborate more with, on things like this with our police chief and, going forward with all the experts.
Okay. Thank you. Supervisor Ryan?
If I can stop coughing. First of all, Tiffany, thank you for Brault. Thanks for sharing your story, because I think there's probably a lot more people that, many of them sitting in this room probably who've had similar situations. So not easy to do on a public situation. But I'd like to ask if Jerry could come down, because out of anybody in this room who's experienced a lot of different people in crisis, and Jerry has been there since the very beginning. I'd like to ask Jerry to come down and answer a few questions about this closing.
Okay, Jerry, would you mind coming down? Now, this isn't going to turn into a Q&A of Jerry. We're going to allow a specific question, and then we're going to move on so we can continue to debate. So.
Jerry, just share with us what you feel the image is going to be. You have been there since the beginning.
Yeah.
Okay.
Well, not the beginning, but for 20 years.
Just about then. But you have been the closest to this than any of us who have to make this decision tonight.
Yeah.
I think all of us have had a number of conversations. I've served on your committees over the years. I've chaired those committees. These are not new discussions. These are discussions that have taken place for many, many years. We started off with how many beds, Jerry?
25. We had 25.
We kept cutting the beds to try to make this thing work. We have done this for years. So share how we got here, why we're here, and what's the future going to be, because everyone's afraid of the boogeyman. And I think once they're informed, I think you're going to be able to settle some of these fears. And you've done it a number of times, but for some reason, people aren't hearing you.
Yeah, I don't, excuse me, I'm not quite sure where to start in this story, because you're right, I have mentioned this many times, and we showed you the 10-year analysis of the bed census, and it continues to decrease, and that's not just Fond du Lac beds alone. I mean, that's statewide. Our inpatient days are going down. There's a number of reasons for that: innovations in medication, crisis beds. All counties are faced with budget challenges. This isn't just a Fond du Lac County problem either. So my colleagues are also looking at, how do we reduce our inpatient days? What can we do differently? How can we expand our crisis programs? Do we build a crisis stabilization facility ourselves? All of these different things are happening statewide. So as we've heard, we know that there are not many county-operated inpatient units, right? Most counties are not in this business for a reason. There's a lot of administrative work that comes along with it. Healthcare staffing is in itself an issue. Again, statewide, nationwide, we have healthcare shortages. So again, none of that's really new. But for the last 10 years, I can go back to 2016, and I can visualize the staffing difficulties that we've had, from MDs to nurses to CNAs. All across the board. We have robbed Peter to pay Paul, from our outpatient department to our inpatient. We've had to have inpatient come to outpatient. Staffing is a challenge. And we haven't been able to stabilize that. So again, we have all of these staffing challenges, and we have our census continuing to go down. So out of our county hospital, we have 5 Fond du Lac County residents. The others are from our partners that we work with. Yes, they will have to do things differently on their end too if we are not a resource for them. But again, as we continue to see, crisis services change statewide. So when we talk about this plan moving forward, and I just struggle with that a little bit, because the plan is to increase our crisis presence. That is the plan. We have to hire additional crisis workers if we do not have the acute unit, because Chapter 34 requires a 24/7 response by a clinician or by a trained crisis worker. So that's not negotiable. It's not optional. We have to do that. There are different ways you can do that. Does the county have to employ staff? No. Some counties contract it out. I mean, there are different ways that is operationalized. But how we have pulled from different models statewide for what we think will work here. And that is hiring additional full and part-time crisis staff to not only answer support calls, but also to do those immediate assessments, mental health assessments on the spot, whether that's in the community, whether that's at the healthcare center, at the hospital, wherever that might be. So that is our plan. As Supervisor Luehring said, the inpatient care that's not going to go away. That's not going to disappear. That is still going to be a need that we have. We are just not going to be the provider of that service. We will rely on our other partners, our SSM across the parking lot, who I have had multiple conversations with about this and how we continue to partner moving forward. Again, we're not that far away from Winnebago, and I know that people have their opinions on that facility, but it is a treatment facility, and it is used statewide. And we have many others, many within an hour travel distance from Fond du Lac.
And Jerry, for those residents from Fond du Lac County that go to Winnebago or go to another facility, we're going to pay the bill for that, am I correct?
For some of them. If they have, again, that gets complicated, but if they have private insurance, that private insurance is billed. If it's at a public hospital, like an SSM, for example, they bill private insurance and then they bill the client. That is typical for any healthcare service, right? I mean, that's the standard. If they go to Winnebago and they're between 18 and 65, yes, the county is responsible for that because they don't bill MA. So there's a lot of different variables there, so the county will still have some responsibility for that cost.
And Jerry, with how many years of experience do you have in this position?
Well, which position is that, Marty? Because
you've had multiple over the years.
I have, but I mean, when I started my career in Fond du Lac County 20 years ago, it was on the inpatient unit and in crisis intervention. That is where I started.
And would you say that you have probably some of the highest years of experience managing, running these systems as probably any administrator in the state?
I mean, here, yes, I guess. I mean, not solely by myself, over the years, of course, I've had other, I've been in different roles, but yeah, I've been doing this for a long time.
So that's where I'm leading my decision tonight, is on what you're telling us. I mean, I understand the emotional aspects of this. I walked in here tonight with a resolution to amend this to which I shared with Mary Hayes, to send this back to committee. I had numerous conversations, but what I'd like to do is I'd like to send this resolution back to your committee, and you guys deal with these issues that are here. This would be you want to collaborate? There's 5 bullet points you can start collaborating on and work and collaborate with the office and the administrator and the county executive and start collaborating instead of not voting and not letting us. That's why we have committees here. We need people to make a yes or no so we can direct. So I will hand this off to the committee members, and you can use this as a guideline. You have lots of power now that you understand. Now utilize it. Become part of the solution instead of just saying, well, we're going to just keep spending money, and we can't. We can't just do it. Jerry's got a good plan. As an administrator, Jerry, I give you a lot of credit for going through this hell right now. And I really appreciate what you've gone through.
And moving forward, I mean, the Health and Human Services, the Human Service Board is a place where people can come and we can talk about these things. And I've made myself very available. I know that historically we've had other committees where people could bring mental health and substance use concerns, and there was a little bit more discussion about that. No one is saying that we can't do that. We can't form those things on the side of this decision, but ultimately we still I mean, if there is no inpatient unit, we have to improve and enhance our crisis services. It's not optional. We can do other things on top of that, and we can be collaborative, and there might be funding opportunities to do something a little bit differently, but I do have to think about that, and the crisis program does generate revenue. So there are things that we can do down the road, but we have to start somewhere.
Thank you.
Okay, thank you. You can sit down, Jerry. Thank you. But we may need you back in worst case scenario. So, but Supervisor Dornbrook.
Thank you. I first want to say that I voted no on Supervisor Hayes' amendment. One, because I was reluctant to send it back to a committee that had decided not to take any action on it when it was last brought to them. Not sure what they would have came out with the next time around. I also wanted to hear, I thought I heard Supervisor Ryan say that he had a possible resolution or proposal, and I respect him, and I thought that I would like to hear if he was going to do a resolution. Okay, no, that's fine. I wanted to hear that. I would also, at this time, like to acknowledge Supervisor Brault's courage for her struggles in her teenage years. I have first knowledge of mental health struggles. I had an aunt who spent most of her adult life in mental health facilities. There were times when she lived with us and her and my mother would get in arguments, and I was the 16-year-old kid that had to transport her to Winnebago Mental Health or the Fond du Lac County Health Care Center. So I do know about struggles. I, along with Supervisor Conley, Supervisor Dean Will, and myself, have transported people in crisis, so we understand it, we see it, we felt it. There were times that we left the acute unit just wondering what the heck's going on and how is this person going to survive. I alone have taken probably 50 people over 45 years to an acute unit, not just in Fond du Lac, but Mendota, Winnebago, and Green Bay, Neenah. So I do understand their struggles. I also can tell you, and I think Supervisor will acknowledge, that our health care over the last few years, the acute unit's not what it used to be years ago. It's sort of a shell of what it was because it's, I think, and mainly because it's staffed by contract workers a great part of the time, and they don't have the care or the dedication that when we had local nurses from Fond du Lac County area taking care of Fond du Lac County people. They had, I believe, more compassion. I also can tell you that when Fond du Lac County started the crisis intervention team, I wasn't sure how that was going to work, and I've seen just great results from it. These people, again, they are local residents, they're county employees. They have so much compassion and dedication. I mean, they monitor the scanner, and if they hear an officer at some place that might be a mental health issue, they call up and say, do you want me to come over? And of course, the officers say yes, because they're the experts. And years ago, we had to decide as an officer whether we were going to commit somebody. And of course, we always erred on the side of caution, which meant that maybe some people that didn't need to go to the health care center, acute unit, were going there, which was very traumatic for those people. So again, I was hoping that maybe Supervisor Ryan would have came up with a amendment or so that we could have moved forward, but I agree with, if he can share those points with the committee if the unit is closed, that we can move forward and get things taken care of soon. How to move forward, I think that would be a great idea.
Okay, thank you. If Supervisor Ryan wishes to discuss that later, we'll allow him, but I'm going to continue to go through people that haven't spoke yet on this issue. So next I will take Supervisor Rodman.
Yes. I'm in favor of continuing to provide services by the acute unit. The decision to keep this valuable service active or not is coming to a vote divided between those of us who are strongly in favor of keeping it open and available around the clock and those who are concerned with the cost of maintaining it and therefore thinking it should be closed down. Until now, the acute unit has demonstrated the value of addressing the mentally ill and otherwise disabled persons as those in need are identified and addressed as they are identified. The services provided are services which often require an immediate response. In many cases, those with problems cannot wait. Although we would be saving funds as we stop serving those who need immediate service, the cost of providing services for those who wait can require a great deal more as the problems are not treated because they could not wait to be medically helped. These expenses cost us more. I believe that we should keep the doors open. And I also think we should take note of the number of people who came to the committee meetings and were feeling very strongly about this issue. Thank you.
Thank you. Supervisor Dean Will.
Thank you, Mr. Chair. My request was what Supervisor Ryan had made, so I have no further questions or comments. Thank you.
Thank you. Supervisor Sippel.
Please bear with me. These are two responses I received through my social media over the weekend. And I did receive not only a lot of responses through my social media account, but also phone calls and text messages. I'm not going to disclose the name, but this is the first one. Before closing the acute center, please have a plan in place to help Fond du Lac County and city residents. Throughout my 38 years as a fifth grade teacher, former students have been placed in the acute center due to mental health issues. The Fond du Lac County and City Police and Sheriff's Department deals with so much already. Early crisis prevention programs can hopefully keep more residents out of the acute center. Thank you for asking and listening to Fond du Lac City and County resident opinions. And this one, unfortunately, I am in District 11. I don't know who that is, but having been a client at the health center for 16 years, the psychiatrists and therapists were always playing catch up. Therapy appointments still remain at 3 to 5 weeks for return visits. Psychiatrists book out around 3 to 5 months, and it is not uncommon to get a call saying, "Your appointment has been canceled, we need to reschedule." Maybe things have changed, but after hours and weekends, the crisis line was answered by the acute staff. All they told me was to hang on through the weekend and contact my provider on Monday. Sitting in the middle of a crisis that happened Friday night and being told to wait it out for 2 to 3 days is ridiculous, especially when in a bipolar, rapid cycling situation. Thank you.
Okay, thank you. Supervisor Hayes, second time.
Thank you. Did I speak twice on this resolution? I spoke on the amendment.
No, you spoke at length.
Right at the beginning?
On the resolution, and then you made an amendment at the end.
Right, I don't have much left to say.
It's okay. Okay, just clarifying here.
It's getting late, I can't remember. First thing I want to say is, I think a lot of people don't realize the history of Fond du Lac County. Every county in this state has not had an acute unit. As a matter of fact, very few counties in this state have had an acute unit. I asked Jerry today if she could tell me of the counties that have closed their acute units. And she only had one example in the past 20 years, which is Milwaukee. And they did move to another model that has a private provider, but they still have the care within their county. So I want everyone to realize we can't talk about us doing something like other people have ever done it. They have never done it. And we have a very, very strong history of exceptional attention to mental health care. That's why we have an acute unit. In 1972, we were the first county in the state to open that mental health care center, which is where the acute unit is now, where Harbor Haven is, where all of our walk-in services are. That entire building was a mental health building. I also want to address another thing that Jerry explained to me really well today, and I think this goes to something that Supervisor Luehring said about we're going to know the costs if we do this. I think that is probably a misperception because Jerry told me our big problem is we are a healthcare provider, and healthcare is volatile. You don't know who's going to pay you, when they're going to pay you. You don't know when Washington, D.C. is going to enact a policy that is going to change how much income you can have. You don't know when Madison is going to change something. So I think the unknown part of it has to do with the fact that we're operating a medical facility. And I can see where that is a really, really huge problem. Then on the issue of transports, I realize this is an important thing to our law enforcement, and it's because we're shifting costs to them by not having the unit here. And what I feel about this is if we are going to look at this, reimbursing them for costs or whatever, why didn't we do it? Why isn't part of this plan that we're all looking for and that people are asking us about? So when somebody comes to me with that, or when the law enforcement says something about the details, I can say, here's the plan, here's what's going to happen. And also that they have been talked to about it. Maybe we put some agreements in place. Some of the things that have been asked is, why don't we have an agreement with SSM? They're right here. Well, let's have an agreement with them. Other counties do that. They have agreements with private providers. The last thing I want to say is, no doubt we are going to have to change. I don't think anybody is disputing that. The question is how we go about that, who we bring in, who we talk to. You know, I realize that Jerry has exceptional expertise. But I also believe there are other people in our community who are intimately involved in this, who may not have the same expertise, but it affects them, and they are involved, and they also need to be brought into this. And I want to point to something that has been brought up earlier, and that is how the public perceives us and how they perceive government. I am troubled to read people saying the fix is in. The minds are already made up. I don't want the public to think that we're not listening to them and that we don't care about them and their opinions. I know everybody on this board cares about the public. I know everybody takes their job seriously. And that, to me, is a big misperception. And I think we have to work really hard to change that. And one of the things that we do is do more of what we do in public. And that's public meetings and making the stuff available. I mean, like this meeting will not be available to the public to view until probably Thursday. And part of the reason that the paper doesn't report on our meetings is because this is not available tomorrow for them to report. So I am going to vote against this resolution, and I hope you all will join me.
Okay, thank you. Supervisor Ryan, did you want to clarify a few things, or I'll move on to the other people that have asked for a second time?
I can quickly clarify.
Okay.
The board was asked about sending this back through Supervisor Hayes' decision. It was very clear that the direction was not to send it back. My resolution or my amendment was to send it back, okay? And I walked in here with this, but Ms. Hayes had hers go first, and that's fine. And it was clear from the board that there's not an interest of it going back. If there's anything, I want this to go back to the committee. I will share this with the committee. I don't think coming up for another vote and seeing where my vote goes is going to advance what our situation is tonight. If it would have went first, maybe it would have been a different outcome. I can't tell you. But I will use this, and I've given it to two of the colleagues behind me who are on the committee. I think this is a framework that was missing in that resolution that would have helped at least convince me that maybe it could go back. But hopefully we can resolve it and go from there.
Okay, thank you. Supervisor Luehring, for a second time.
Yeah, I just wanted to clarify a couple things. So I gave estimated costs, and I didn't say that we would know that we know the cost. What I said was that these are the estimated costs. We won't know the costs until budget time, but we are upon that time. And I reached out to the county executive, and he clarified that this is what we're looking at. So we will know the cost for this coming year in 2027 for this. So I just wanted to clarify that.
Okay, thank you. Supervisor Griffith, I believe, for the, I'm not sure. Anyway, Supervisor Griffith.
Thank you.
Track here, sorry.
Yeah, so I wasn't expecting to be at this meeting tonight because I was in northern Minnesota camping, but I got on the road at 7 o'clock this morning and drove here almost from Bemidji to be here because I feel really strongly about this. I didn't want to miss this meeting. What I feel so strongly about is the trust between us and the community. It's our most important treasure. we're spending the public's money, how they feel matters. I'm not sure that this unit is sustainable over the long term. In fact, I think it isn't in its current form. I will not be surprised if at some point we close it, but I think it's premature to close it when doing so would send such a strong signal that we are not listening and we don't care what the public thinks, because the public has been very, very clear. And I think Jerry has done a great job of beginning to bring more people into the conversations. I think some good things have happened in recent weeks, but I think there's a lot more work to be done to make it clear that we really are listening, we really are willing to partner, we really are trying to work together to build the best system we can and have something going forward. And it may not look like the acute unit currently looks, and I would be okay with that if we've really done our work, but we have not done all our work. There are too many people who haven't had a chance to be really partners in this. Yeah, we've listened to them speak for 3 minutes. That's not the same thing as inviting them into real partnership and getting the benefit of their experience, understanding fully their needs, and looking for ways to problem solve together. That's the part that we really haven't done. I would love for our committee to do that. I would put myself forward as a volunteer to put in a lot of time on this. I care about it deeply. As a very brief aside, mental health is a serious issue in my family. Suicide is the leading cause of death. It took my grandmother, my mother, and my sister. So I know what this could look like, but that's not where I'm coming from right now. For me, the most important thing is that our public trust us. We have so much hard work to do. We need to have that trust to do anything well and to represent our people. I think it would just be terribly damaging if we ignore all the voices that have come forward to talk to us about this. We need to listen to them. We need to show we're listening to them. We need to build the trust. We're going to need every bit of it for the next steps on the jail. So please, let's not vote tonight to shut this down before we've done the work that we need to do. Thank you.
Thank you. Supervisor Mike Will.
Thank you, Chairman. I'm going to make sure I say this right. First of all, going back to the original amendment, I could have supported that, but I heard Mr. Ryan say he had one that was more targeted and give them guidelines what that they need to work on. They just don't send it back to committee and all of a sudden, you know, without any guidance, I should say. But I'm going to go back to people spoke loud and clear at these committee, and they were respectful for the most part. That they want to pause, they're not saying it needs to stay open, but they want more clear information, the direction they're going to go. And I'm not convinced law enforcement has all the answers they need. Fond du Lac's police chief probably handles more of these patients than anybody else in the county, and he didn't say it should not close, he wanted to pause. And so I'm not going to support this. We preach to people all the time, speak at the committee, and they did. They all spoke, maybe one or two spoke in favor of it. So why would they come and speak again at any of these committee meetings? Because they're not being unreasonable. They're just asking a pause and get all the information out there for the parties that are involved. So again, I won't be supporting it as is. Thank you.
Supervisor Dornbrook for the second time.
Again, like Supervisor Will just said, when I voted no, not to send that back to committee, I was hoping that Supervisor Ryan was going to come forward with a resolution that had what I thought he said were 5 points that would be more directed or direction for the committee. So what I am going to do now is respectfully ask the chair if he would be willing to ask Supervisor Ryan if he would go ahead and give those 5 points that he was talking about, and that would determine my vote moving forward.
Mr. Ryan's already spoke twice on this. I respectfully will not ask him to speak. It's out of order. Sorry, Supervisor Dornbrook, but yep. You may, yes. I guess while you're reading, well, while we're doing that, Supervisor Depperman.
I'd like to call the question.
Okay, that is in order. That does require a second. Is there a second to call the question and debate? Supervisor Dean will, that is seconded. Just for clarification, that I'm going to ask Corporation Counsel to clarify this with me. That I'm trying to find it on my information on motions. Is that debatable? Don't believe it is, right?
It's not debatable, and it requires a
Requires
two-thirds
a
vote.
two-thirds vote. So that motion has been made and seconded to call the question. So once we get an order up, once we get things squared away up here, we will move to a vote on calling the question. There was not? Well.
Okay, I did look at the 5 points from Supervisor Ryan, and I do believe that if the vote today is to close the acute unit, that the committee can move forward with his 5 points of addressing this issue.
Okay. Well, we have a motion to call the question on the floor, made and seconded. Supervisor Depperman did have the floor, and that is in order. So we're going to move to the vote. All those in favor of calling the question and moving to directly to the vote, press your button aye. Opposed, nay. Supervisor Beer? Close your vote so we can put it, there we go. Okay. Okay, we have the calling the question has been passed, 19 in favor, 5 opposed, with Supervisor Mike Will, Supervisor Simon, Rickert, Brault, and Janke voting in opposition of the calling the question. So debate is over. We now move to the vote on the regular resolution once we get squared away here. Yes. All those in favor of the resolution, press your button aye. Opposed, nay. Resolution has been approved, 15 in favor and 9 opposed, with Supervisor Griffith, Mike Will, Sippel, Myrachuck, Rodman, Herlache, Brault, Janke, and Hayes voting in opposition.
Sorry, our next resolution is authorizing the